Excellencies, colleagues, friends, good morning. Thank you for being here. We began today by writing our worries and our hopes. I am carrying both, but this morning I choose to let hope lead. My name is Margaret Odera. I am a community health worker in Mathare North, Nairobi, and I'm a person living with HIV. I'm here to share what the last months have looked like for my community and why sustainable professional community health worker financing is not a luxury. It is the backbone of health security. In February, the services began slow. In March 2025, fear became real. In our HIV services, patients began receiving only 1 month antiretroviral instead of the usual 6 months. Viral load testing kits ran out. I myself, I missed my viral load test because the kits simply were not there. In immunizations, there was an acute shortage of vaccines, especially pentavalent, the critical vaccine for newborns and young infants. Mothers traveled long distances, 200 kilometers or more, to search for a dose, and sometimes arrived to find that there was none. There was staffing gaps. In some days, there were no doctors or nurses to dispense medicine. One day, 17 pregnant women living with HIV went home without ARVs for PMTCT, and that is a sentence that no one should ever think or ever speak. Community health workers stepped in. We took blood pressure and weight. We triaged clients. We called the county nurses. We did whatever we could to keep the line from breaking. But emergency improvisation is not a health system. It is a warning. Today, thanks to AHF and CHW, my clinic has stabilized. Yesterday was my clinic day. That was on Friday. I received medication through February 2nd. Nearly 5 months from now. In many facilities, we are back to the 6-month supply. This is a relief, and I am grateful. But these are contracts. They are temporary. The fear still remains. But for how long? Viruses don't need passports or visas. If there is an outbreak in one county or one country, it can become everyone else's crisis. Polio, TB, measles, Ebola, they don't respect borders. If a newborn misses a routine vaccine today, that gap can become tomorrow's emergency. When funding is abruptly cut, the first cracks appear in community, and then they spread. When community health workers are paid, trained, and integrated, we extend reach, we keep people in care, we sustain trust, we help every dollar go further, not just by saving money, but by multiplying impact. Stretching scarce resources and building durable platforms that make health systems resilient. My worry is simple, that we accept emergency chip-ins as a strategy. My hope is also simple, that we commit to professional, salaried community health workers and sustainable financing so that what happened in March should never happen again. Thank you for listening.